When you are on GLP-1 medication like Wegovy or Zepbound, it is natural to focus on the number on the scale. But the truth is, your health is changing in so many ways more than just your weight. Today, I'm going to break down the non-scale victories. These are the hidden wins that prove that these medications are improving your health beyond the number on the scale. And at the end, I will share my favorite patient and community wins. Hi, I'm Dr. Bazgha Khalid. I am board certified internal medicine and obesity medicine doctor. And on this channel, my goal is to help you understand wellness, weight, hormones, and metabolic health in a clear evidence-based way, and to build a safe community that helps and motivates each other. If you're new here, hit the subscribe button. So what are GLP-1 medications? GLP-1 medications like Ozempic or Wegovy, Zepbound or Mounjaro are FDA-approved treatments for type 2 diabetes and obesity. These help by reducing hunger, slowing digestion, and regulating blood sugar. If you would like to know more about these medications, how they work, risks, benefits, all of that, I have a video called Everything You Need to Know About Zepbound, and I'll put that in comments below. Most people focus on the weight loss benefit of the GLP-1 medications, but today I'll talk about the life-changing benefits that go far beyond the scale. These are the non-scale victories that excite my patients and excite me as well. Better blood sugar control. GLP-1 medications help reduce insulin resistance. So people with prediabetes and diabetes, their blood sugar can improve significantly. Even before major weight loss, hemoglobin A1C, which is a 3-month average of the blood sugar, can improve significantly, meaning lower risk for long-term complications of type 2 diabetes. A 2021 study in the New England Journal of Medicine found that semaglutide significantly reduced hemoglobin A1C in people with type 2 diabetes, even independent of weight loss. Lower blood pressure. GLP-1 medications also help lower blood pressure, not only because of the weight loss, but because of improved vascular health. I commonly see a drop of 10 to 15 points on the systolic or the top blood pressure number in most of my patients who've been on the GLP-1 medications for a few months. Research in diabetes, obesity, and metabolism published in 2018 showed GLP-1 therapy led to modest reduction in blood pressure and LDL cholesterol beyond weight changes. Improved cholesterol and triglyceride. LDL cholesterol and triglycerides are linked with heart disease, and they can improve on GLP-1 medication. GLP-1 medications also help improve the HDL, which is the good cholesterol. Therefore, your GLP-1 medication is helping reduce your bad cholesterol and helping improve your good cholesterol. Reduction in bad cholesterol helps lower the risk for heart disease. This is something the scale won't show. The SUSTAIN-6 trial, published in New England Journal of Medicine in 2016, showed GLP-1 medications lower risk for major cardiovascular events in high-risk patients. Better sleep and less snoring. As GLP-1 medications help reduce inflammation and excess fat, many people report sleeping better and deeper. Sleep apnea symptoms often improve. That usually means fewer nighttime awakenings, more energy, and better quality of life. A 2020 analysis on diabetes therapy reported that patients on GLP-1 medications reported better energy, mobility, and satisfaction with treatment even before large weight loss occurred. More energy throughout the day. Since GLP-1 medications help stabilize the blood sugar, people notice less brain fog, fewer crashes, and more consistent energy throughout the day. Joint pain relief. Even 5 to 10 pounds of weight loss can help ease pressure on the joints. Many of my patients describe being able to climb stairs, walk longer distances, or play with their grandkids with ease and less pain. Better digestion and portion control awareness. The slowing of digestion caused by GLP-1 medication teaches mindful eating, portion control, and better relationship with food. GLP-1 medications make you learn what fullness really feels like instead of overeating automatically. Clothes fitting better. While on GLP-1 medications, sometimes the weight or the scale stalls while your body composition is still changing for good and your waistline shrinks. Patients often tell me that their clothes or their jeans fit better even when the numbers on the scale is not changing. Reduced food noise. GLP-1 medications make you less hungry and you're not constantly thinking about food. That mental freedom is huge. One of the most powerful changes that the patients describe to me and get excited about is less food cravings. Some of them tell me food noise is gone. Others say I don't think about food all the time like I used to. Others would tell me food chatter is gone. What has been your experience on GLP-1 medication? Please tell me in the comments below. Confidence and emotional wins. When you notice yourself saying no to late night snacks or feeling more in control at a party, those wins are huge. These shifts improve self-esteem in ways the scale won't tell you. Better lab numbers. GLP-1 medications help improve insulin resistance, lower your liver enzymes and inflammation markers. All these changes are invisible to the eye, but very critical for your long-term metabolic health. Mobility and physical strength. Everyday tasks like tying shoes, walking, carrying groceries become easier. Many patients tell me that they look forward to going on a vacation or a longer walking trip rather than dreading it. What has been your experience and non-scale victories on GLP-1 medications? Please share in comments. Clarity of mind, mental health. Many patients describe less emotional eating, less anxiety around food, and a greater sense of control. This is a big win beyond the numbers you see on the scale. Reduced need for medications. Since GLP-1 medications help improve sugar, cholesterol, blood pressure, therefore the need for medications for these can lessen over a period of time, something that your doctor should monitor closely and adjust accordingly. Let me tell you why non-scale victories matter. Weight fluctuates daily due to water, hormones, stress, and so much more. So if you're only tracking the number, you will get discouraged. But when you are measuring progress through non-scale victories, you see the full story. Your health is improving in ways the scale won't tell you. Tips to track your non-scale victories. Keep a victory journal. Write down changes in your sleep, mood, physical strength, stamina, energy. Take progress photos. You can take them weekly or monthly. Track your body composition or if your clothes fit better or differently. Also celebrate improvement in labs, blood pressure, energy. Every win counts. I have been prescribing Zepbound and Wegovy for weight loss since their FDA approval. I've had great success using these medications in my patients, and I've seen amazing health benefits and inspiring life transformations. I love when my patients share their non-scale victories, and I'll share a few with you. One of my patients had just returned after the holidays earlier this year after seeing her dad after many years. And she comes for a follow-up and tells me, for the first time in my adult life, I didn't have to ask the flight attendant for a seat belt extender. Those were her exact words. And I don't think I'll ever forget those words or the emotions that both of us had in that room after she said that. It meant so much to her and to me. And then I have so many happy grandparents who share things like, I'm able to get down on the floor and play with my grandkids. I can walk upstairs without feeling tired or winded. I don't feel controlled by cravings anymore. Or things like, I can now finally take better care of my personal hygiene. I have more energy to play with my kids. These are simple but meaningful experiences that I hear from my patients. Not everyone would understand the impact of these non-scale victories, but think of someone who suffers from health problems like obesity. And now, due to the use of these meaningful medical treatments like GLP-1 medications, we see improvement in physical, mental, and metabolic health for these patients. This is huge. Some of you have shared your non-scale victories with me. Let's celebrate them next. So one of you wrote, I am living proof you're so correct. I've been on semaglutide for just over a year, microdosing. My A1C started at 6.4 and now is 5.6. My blood pressure went from 140s to 115, weight from 206, now 161, bad cholesterol in the low 80s. I turned 70 in November and feel amazing. My internist gave me an A+ on my labs. Way to go. The reduction in the systemic inflammation and body pain in the first 3 days after my first dose of 0.25 Ozempic was a miracle. All these benefits apply to me 2.5 years in and doing excellent with 52 pounds down, better overall health, vitality, and maintaining at 1 milligram weekly. I've been so inspired by you. I've subscribed to your channel. Thank you. I'm on semaglutide and have lost almost 3 stones in a year. I feel great, and it's nice to know it's helping me in other ways too. I'm 69 and have osteoarthritis and heart failure, plus I was pre-diabetic, but now I am not. Win-win situation. I've gone from a size 24 to a size 12, lost, never been found again, 95 pounds. I've stopped taking blood pressure medicines and cholesterol medicines. I'm off my CPAP machine. I no longer have dense breast tissue, and hump is gone. I've not had an atrial fibrillation episode for over 19 months since I began Zepbound, which means my husband has not had to rush me to the emergency room just to watch me straight line and brought back to life. My knees and back no longer hurt me when I walk. This is truly a miracle drug, and I cannot wait to see what other benefits GLP-1 brings to humans. Number on the scale is just one piece of the puzzle. If you are on a GLP-1 medication, remember to celebrate all your non-scale victories, whether it is better, deeper sleep, better blood pressure, better sugar control, increased confidence, or freedom from those constant cravings. These are all huge wins. These wins are a proof that your health is moving in the right direction, whether the scale agrees or not. If this was helpful, please like, share, and subscribe. And let me know what non-scale victories excite you the most.